And welcome back, everyone. We are continuing our health care discussion with Dr. Karen Gallagher and Dr. Ed McBride with Summit Medical Group. Once again, thank you both for being here. This is certainly a known, given the Obamacare, if you will, that there will be more people in need of health care. That means we need more doctors. Will there be enough doctors there to treat the masses of people who will be coming to them?
I think that's a difficult question to answer. I think we're all concerned the projections show that there will be fewer physicians to treat more patients, and that's what everybody's concern is. The actuality of that situation, I think, is yet to be determined, but certainly things that might have driven people into medicine in the past are vastly fleeting. The ability to have your own business, the ability to avoid a lot of management in care plans is not really available anymore. There's still a lot of liability in treating patients. There's a lot of cost in your practice. And so I think there are things that many young people might feel intimidated by in proceeding into medicine. But I think we have to wait and see what happens. I'm not sure we're going to know that for a while.
Yeah, Dr.
Along those lines, I think that the reason I went into medicine, I was great at math and science, but I couldn't see myself in a lab the rest of my days. And I really enjoyed the interaction with people. I think that there will be enough physicians to care for the patients, but I think the way that we deliver health care is going to change somewhat. I think physicians, rather than being the singular focus, in a patient-centered view, physicians may direct the care of populations of patients utilizing teams of healthcare professionals that are at their disposal. So maybe certified diabetic educators, for instance, will help educate diabetic patients to take better care of themselves and therefore take custody of that disease, own it, and then take better care of themselves. Likewise, we'll have health educators out there. We may have care coordinators. In fact, Summit does have care coordinators right now working with Medicare population patients that are considered high risk. The whole goal there is to enable those patients to live happier, healthier, longer lives.
Some of the criticisms are that patients and doctors won't spend as much time together, and that patients will be seeing nurse practitioners and other folks in the office rather than spending time with the doctor. Dr. McBride, we'll start with you, but I'd like both of your answers to this question. How do you see it impacting that doctor-patient relationship?
Well, to be honest, there has been some negative impact on the doctor-patient relationship in relation to the amount of time the physician spends dealing with the changes that we've discussed. Electronic medical records are one of those. I think the benefits outweigh the negatives, okay, although not everyone may have that same opinion. Over time, I think that the physicians will work with care coordinators, extenders, mid-level providers, whether it be physician's assistants or nurse practitioners, to help extend their reach over greater populations of patients. But physicians will, because by very nature we enjoy spending time with patients. We enjoy those relationships.
Oh, this is such a difficult question for me. I started my career in a large county hospital where we had a lot of extenders and residents, and as an attending physician had very little contact with patients, and although I felt like we delivered good care, it wasn't what I was hoping for when I went into medicine to take care of patients. I really enjoy my patient contact. I like to be able to spend an hour talking to somebody with a new breast cancer diagnosis, and my concern is if I make the financial moves to move into a large practice that's volume driven, and I have 10 minutes, I have to see 60 patients today. And there's a great reality about that concern as well. So although I agree with Ed that I think that we will be able to provide care for all these patients, it is definitely not going to be the kind of care that we had in the past. Marcus Welby's dead. It's just not going to happen anymore. You may have some boutique physicians that have practices that are outside the larger scope of corporate medicine, but for the most part, we're not going to have that same kind of primary call the doctor's office, either talk to the doctor as nurse right away. It's not going to happen like that anymore.
We need to take another quick break. We will continue this discussion right after this. Stay with us.
On WBIR.
Cheer on East Tennessee's Amanda Hill tonight at 7 on Wheel of Fortune, right here on Channel 10.
The 2013 Ford Escape is here at Ted Russell Ford. Smart technology, modern capability, excellent fuel economy, and a great value. Starting at $21,869. Ted Russell Ford, Parkside Drive and Kingston Pike.
Hark the herald angels sing, glory to the newborn King. Peace on earth and mercy mild, God and sinners reconciled.
This week at Ingles Gwaltney Honey Glaze or Brown Sugar Ham, $1.57 a pound, limit 2. 4-pound bags California Navel Oranges, 2 for $5. Select 2 to 8 packs Duracell batteries, $5.98 each. And select sizes and varieties Hormel Black Label Bacon, $4.48. Ingles low prices, love the savings.
The Mercedes-Benz Winter Event is back with the perfect vehicle that's just right for you, no matter which list you're on. Hurry, the offers end December 31st. Lease a 2013 C250 for $349 a month at your local Mercedes-Benz dealer.
We're the host, time to put on a show. We're the host, always on the go. We're cooking and cleaning and getting things right. We put our lives on hold to prepare for this night. We're not sure how we got the job to serve a big meal, but we're doing all we can because it's such a big deal. Yes, it's all up to us, that's why we make such a fuss, because we're the host, the host.
The holiday meal is a big production. Make sure the ham you serve can live up to the occasion.
This deal.
Celebrate the 20th anniversary spectacular of Moscow Ballet's Great Russian Nutcracker. The Christmas experience your family will never forget. Celebrate the season with world-class Russian dance and Moscow Ballet's Great Russian Nutcracker. Get your tickets now for friends and family at nutcracker.com. Appearing at the Tennessee Theater December 22nd. Purchase your tickets at nutcracker.com.
The 2013 Ford Escape is here at Ted Russell Ford. Smart technology, modern capability, excellent fuel economy, and a great value. Starting at $21,869. Ted Russell Ford, Parkside Drive and Kingston Pike.
Sergeant Rex Stolniker did 2 tours in Iraq and Afghanistan, but witnessed his most traumatic attack on a military base in Texas. The ongoing fight for recognition for Fort Hood soldiers' service and sacrifice. Thursday at 5 on 10 News.
Join the WBIR Facebook family and follow us on the go with Twitter. Visit WBIR.com to sign up today.
We're basically going to be having to change almost the whole model of the way we practice medicine, at least from a primary care standpoint. We're going to be depending more and more on physician extenders, such as the care coordinators, but also nurse practitioners and physician's assistants to help to take care of some of the chronic medical problems, which will help us to improve quality, but also gives patients more access.
Welcome back. We are wrapping up our healthcare discussion with Dr. Karen Gallagher and Dr. Ed McBride with Summit Medical Group. And again, thank you both for being here. Dr. McBride, let's speak to the fear a little bit that a lot of people have with the coming changes. You were mentioning a personal story in the break, but where do you see this fear going?
Yeah, patients are real concerned about having access to physicians, access to appropriate health care, and I think the message we need to drive home is you are going to have access to health care. The processes and the systems that we're putting into place are going to enable the physicians to take better care of their patients, utilize appropriate extenders, utilize professionals in a team-based approach to health care that's similar yet different to the kind of health care they receive today.
Let's talk about your practice. With a lot of change ahead of you, where do you see your practice going?
It's a very daunting future that's going to require a lot of flexibility and revision. I talk to my patients a lot about what this might mean. Certainly it might mean that I have to drop taking Medicare patients or Medicaid patients. That's pen care. That's one possibility, which I find very onerous because I like to be able to take care of everybody that comes through my door, but it doesn't pay the bills, and the paperwork is becoming so insurmountable.